In the last few years, prescription drug abuse has become much more prevalent. In 1 year, 1.6 million people will be hospitalized due to prescription drug overdose, and 160,000 of them will die due to their reactions. The reason why prescription drug abuse is so widely known is because its abusers range from the elderly all the way to 10-year-old kids. Another reason is because it's so easily accessible. No. Another reason why it is so common is because prescription drugs are so easily accessible. No longer do people have to walk into shady neighborhoods to buy drugs. All they have to do is open their medicine cabinet or walk down to Walgreens. Increasing numbers of teenage users have been seen in the last few years. Many teenagers view prescription drugs as safe because they are often given to them by doctors or parents. They are also very easy to get and inexpensive. Prescription drugs are tied with marijuana as the most popular drug used by kids under age 18. One of the most popular prescription drugs among teenagers are pills prescribed to kids for ADD and ADHD. Many kids are being prescribed these pills by their doctors, but then these pills are redistributed in school to people without the disorder.
As more and more prescriptions are being written for medications to treat ADHD, such as Adderall and Vocalin, more and more children are abusing these drugs.
Kids and teenagers are often prescribed ADHD medications because of their inability to pay attention, follow instructions, or sit still. Distractibility can lead to problems at school and outside of the classroom. It is true that ADHD drugs have the potential to benefit those who need them by reducing the risk of injuries and car accidents. But research also proves that these pills may be damaging to their health as well. ADHD drugs act by stimulating chemical neurotransmitters in the brain, such as dopamine. Adjusting these neurotransmitter levels can be highly effective in treating disorders such as ADHD, depression, and anxiety.
Many take them to improve sharpness or even to lose weight, but when the drugs are crushed and then injected or snorted, they can produce a high feeling and exaggerated self-consciousness that can lead to dependence. Specifically, the National Survey on Drug Use and Health showed that in 2006 and 2007, about 6.4 of full-time college students reported such stimulants as Adderall non-medically in the previous year, and this contrasted in 3% of the students who were not enrolled in a full-time college. The abuse continues to escalate well into the college years, particularly as a means to students who need to perform better. Adderall is referred to as college crack, or the Adderall advantage, for this reason.
Along with behavior-altering drugs, painkillers also see record numbers of abuse.
If the 1960s can be described as a marijuana decade and the 1980s can be defined as a rampant cocaine abuse, then the first 10 years of the 21st century may someday be seen as a time of overwhelming abuse of prescription drugs.
One of the most commonly used painkiller is Oxycontin or oxycodone. Users who use this drug may experience allergic effects of the drug, which include seizures, fainting, confusion, or even insomnia, vomiting, and nausea.
Between 1985 and the 2000, the number of young people ages 12 to 25 who abuse prescription painkillers such as Oxycontin and Vicodin for the first time rose from 400,000 to 2 million. Between 1998 and 2000, the number of emergency room visits related to the improper use of Vicodin rose from 48%, while the number of ER visits due to Oxycontin increased by 108%. Prescriptions for ADHD medication increased by 72% between 1995 and 2000.
Depressants and antidepressants are now responsible for more overdose deaths than cocaine, heroin, and methamphetamine combined. In the United States, the most deaths used to take place in inner-city neighborhoods, but they have now been overtaken by white rural communities. The same trend can be seen in the rate of hospitalization for substance abuse and emergency room hospitalization for overdoses. Of the 1.4 million drug-related emergency room admissions in 2005, 598,542 were associated with the abuse of pharmaceuticals alone or with other drugs. Along with young people, the elderly can also see damaging effects. When a single prescription drug is taken, it can disrupt multiple cell functions, causing thousands of biochemical changes. Once a second drug is introduced, it can cause tens of thousands of changes, and a third can produce hundreds of thousands. Since the average patient over the age of 60 is on 4 drugs at one time, you can imagine that the effects are not very healthy. Oftentimes, second drugs and third drugs are put in place to help suppress the problems caused by the first. But after more and more pills are prescribed, the damaging effects increase. It is true that for many people, prescriptions are beneficial and even life-saving in many instances. But hundreds of millions of these prescriptions are wrong, either entirely unnecessary or unnecessarily dangerous. In a recent study, it was found that 21% of patients 65 years or older were using at least one drug inappropriately prescribed. Along with the health effects, misprescribing prescription pills waste tens of billions of dollars, which is barely affordable by many people who pay for their own prescriptions.